Hello, I'm Jeannine Hansen, and you'll never guess, today we're talking about motivational interviewing. So, motivational interviewing is a style of conversation between a practitioner and a client, and it's designed to inspire and motivate a client to make change in whatever area it is that they've come to you for assistance with. So, for example, today we'll be talking about exercise adherence as the example. So the underlying spirit of motivational interviewing is collaboration between the practitioner and the client. And the practitioner really needs to have that respect and empathy for the client in discussing the process of change with them. They need to encourage the self-efficacy in the client as well to make that change. And it's certainly not the style of interviewing where the practitioner comes over the top of the client and tells them what to do and how to do it. I feel like it's closely aligned to the Carl Rogers person-centred therapy approach, whereby the practitioner has unconditional positive regard for the client, and they really have that relationship going in that collaborative nature. So the 5 stages of change model is important to consider when we're looking at motivational interviewing. The first stage is pre-contemplation stage, where the client really is not ready to make any changes. They don't see that they have any problems perhaps, and that perhaps they've been told to come and see you in relation to their exercise adherence or failure thereof. So in this stage, the practitioner might discuss with them the risks of the lack of exercise adherence and help the client to identify perhaps the reasons that change might be beneficial for them. The second stage is contemplation, where the client has been able to identify that perhaps it would be good to make those necessary changes, and they are getting ready to make those changes in themselves. The third stage is preparation, where the client has come to you and said, I'm ready to make these changes. And this is where you might talk together in the collaborative nature about goal setting and the strategies and steps towards actually implementing the change that you've come up with together. The fourth stage is maintenance, where the client just needs to stick to it. The practitioner in this stage also might need to pre-warn the client that the next stage of relapse is very common and normal, and almost to be expected, or certainly not to be surprised if it does occur. In this way, if the practitioner has these discussions with the client before the relapse phase, the client can be prepared for it and perhaps even identify themselves what the barriers for their own change process is, and then maybe come up with some ideas and some strategies to combat that relapse before it actually happens. And as I said, the last stage is the relapse stage, where that relapse should be normalised by the practitioner so that the client doesn't feel like they've failed in that sense. And also in this stage, I think it's important for the practitioner to use it as a growth opportunity and help the client to get in that growth mindset as opposed to feeling like they've failed, and using that relapse stage as a learning opportunity to move forward and to get better for the next time that it occurs. And we notice this in exercise adherence, very commonly, where 50%, I think it is, of people fail to adhere to the exercise regime and then start over and start over and start over. As I said, it's a cycle. So how would the practitioner work through those stages of change most effectively using motivational interviewing? The acronym RULE is a very well-known acronym in this regard. And so the R in this stands for resisting the writing reflex. And as practitioners, it's very common to want to help and to want to make change on behalf of the client, but it's really important not to do that. Rather have those deeper conversations with the client about what their motivations for change are, and try to understand them and try to help the client increase their autonomy And by helping the client to understand what their motivations are for change, it helps them to solidify those motivations in their own mind. The U in RULE stands for understanding the client's motives. So if the practitioner can understand the motives, the client also can more deeply understand what their motives for change are. And they can also have that discussion between the discrepancy between what the current behaviours are of the client and perhaps what their future goals might be. And by understanding what those discrepancies are, makes it more realistic for the client to understand the reasons for the change that's required. And also by understanding the client's motives, the client may be able to identify themselves what some of their barriers for change may be. The practitioner should be reminding the client that the client knows themselves best, and so they're the ones that should be able to identify what their motives for change are and what their potential barriers are as well. The L stands for listen empathetically, and this is probably at the base of motivational interviewing. The rule of thumb is commonly 50-50 listening and talking. We certainly don't want to be the practitioner that does all of the talking and has the client doing all of the listening. It is that collaboration approach. And the E stands for empowering the client. If we've done all of these things correctly, the client will feel empowered in themselves to make that change. They've been able to identify what their motives are, they've been able to identify what their potential barriers are, and they've realised that within themselves they do have the confidence and the courage to go forward and make that change and implement that change effectively on their own, but with assistance from the practitioner as well. And once they understand that in themselves, if a setback does occur in the relapse phase, they've got that confidence within themselves to be able to pick themselves up and go forward to try again. AWES is another acronym that's very important in the interviewing world, and AWES stands for using open-ended questions, using affirmations, reflections, and summarising back to the client what they've said. So, for example, as a practitioner, I might say, so what I can understand that you've said to me is that you need some help with your adherence to an exercise program. And the reasons for that is that you've identified that you have some health issues as a result of your lack of exercise. Is that correct? And so then the client can repeat back to you any discrepancies that they've come up with. You may not have heard them correctly, or you may not have understood quite exactly what they've been talking about. And so that's a good opportunity for the client to repeat back to you what they've actually said. And there's another example of that collaborative nature of the deeper discussions between client and practitioner. And in that way, you're also building that relationship for the client to trust you as the practitioner, that you really want to understand what they're saying and that you want to have a firm grasp on what they've said. So there are some reasons that motivational interviewing might not be successful. One of those big ones is a time factor, and another one is where you as a practitioner assume the role of the expert as opposed to that collaborative approach, and this is not an empowering way for the change to occur within the client. Probably commonly also is the client attending wanting a quick fix. So they've been told they've got some heart issues or whatever in relation to their lack of exercise. They just want you as a practitioner to tell them how and why to do it. But it's not the most effective way for change implementation for the reasons that we've seen in the previous discussion. It also is a difficult thing to get correct as the practitioner. So practice needs to occur and training needs to occur for it to get right as well. So those are the principles and underlying factors behind motivational interviewing, and it can be a very effective means of effective change. Thank you very much.